I'm scared. It's like Halloween.
You're scared now. Have you seen the stock market? Oh my God, Teledoc, what happened?
Oh my God.
The October 31st Halloween edition of Health in 2.0. Oh.
Ooh.
Holt, healthcare is scary.
I tell you what, I mean, so Teladoc finally merges with Livongo. The stock market is terrified, falls out of bed, they're down 10%, Amwell's down, although Health Catalyst was up a little bit. So, you know, not everyone's disaster.
No,
but
everything followed mine. Oak Street, everything was just down. I don't know what's
I don't know. It's all that money you've been making. Even Tesla's gone down.
I know.
Okay, American Well, the scary part was the 18 people who told me to keep it. You told me to double down. Should have sold it. Never mind. Oh well.
Trick or treat.
Definitely a trick. A lot of tricks. I got no treats.
All right. Get your timer ready. Where's my timer rooster? What is he for Halloween?
Timer rooster's over time. What are you, a mermaid?
What?
I think you're a mermaid. You look like a mermaid. Do you have a tail?
No.
Well, we just can't see it. Let's pretend you have a tail.
Okay, that would be indecent.
All right. I'm a punk rocker.
Oh, yes, you certainly are. All right, get your timer.
Actually, I look a bit like Garth in Wayne and Garth with the glasses.
You kind of do.
All right.
All right. I can't really see here, but let's do this. Let's hope this acquisition goes a little bit better. Are we ready over there? Medidata acquires MC10. What do these companies do?
Okay, so Medidata, bought by a French company, Dassault, which is the sort of clinical trials technology company, bought MC10, which used to make really cool. It has like about nearly $100 million went into MC10, made like cool tattoos that were supposed to do biomarker patches on your body, tell you your heart rate and this kind of stuff. My impression is that they raised a decent amount of money, even was recently since 2018, but I haven't heard much. Doesn't look like they got into production. And I suspect that they didn't get their money back, those early investors, but maybe it'll get a second life.
All right. What about Navina? They get $7 million in a seed round. This is an AI platform for primary care.
Yeah, well, I mean, they say that, but this is another AI. Let's take data out of this Israeli company. Let's be smart. Let's take data out of the notes, and we'll try to present, better ways of helping people understanding. Now we understand more from the medical records about them, but in reality, it's just going to be another coding software play because they all end up like that.
Okay, so that's their Halloween costume. All right, what about two different telehealth companies get seed money? Nice Healthcare gets $5 million for telehealth for primary care, and Vitable Health gets $1.6 million seed for urgent care telehealth.
Yeah, so I think that there's yet more play in like different ways we can slice that into the intersection between urgent care, primary care, and telehealth. One of these, Vitable, is a minority-led company, also SoftBank money.
Money.
So it's fun, but there's a lot of plays in this space, and more people, more power to them. Hope it'll work, but it's going to be tough sledding.
All right. Speaking of crowded spaces, Koa, a mental health startup, gets $3 million in a seed round. How is there still things to fund out there?
Who knows? All female-led team, so good luck to them. They're paying. You can do a mental health exercise class for $25 a time. Maybe we should give it a try. Might improve ourselves.
All right, what about Quit Genius? This is another crowded space. Smoking cessation is not gone from things to be funded. $11 million in an A, bringing the total up to 13.6. Is that my timer, Rooster?
The rooster is back.
Thank goodness. I'm worried about him. So there's like a ton of people who are in this. It's led by Octopus Ventures. Y Combinator was in it. Startup Health was in it. Eric Rees was in it. Both Serena and Venus Williams. Like, I don't get it.
I was unaware the Williams sisters were heavy smokers, but maybe they need it. But look,
smoking in general.
Yeah, smoking cessation, smoking tools, both on the pharma side, right, with Chantix, and Humana had a product for years that I remember was featured one of the early health 2.0s. There's that company Carrot that's raised, I don't know, 30 odd million to do smoking.
Carrot Health, not to be confused with Carrot Fertility.
Yeah, I mean, so many damn carrots around. There was like another carrot as well. There's all these kinds of people, and there are any number of different ways you can stop smoking. Maybe these guys have got a latest. Even Juul, right, claimed at one point that it was a smoking cessation tool because you started vaping instead of smoking, and they had the NHS say that yes, it did work, and then they sold half the company to the Marlboro Man and kind of lost their credibility.
I feel like that was where your disdain for digital therapeutics really started. Like if I had to trace this back to a conversation, I think it would have been with the people from Juul and how they tried to position it as the DTX. And I think that soured you on the whole category.
Yeah, the one guy who was there, who went there to do digital health, didn't last very long. He called me later and said, yes, I'm out of that. No, I'm doing something else. I think hopefully he was there at the right point where they got the payoff, because a bunch of people at Juul, when the money came in, unlike the WeWork money, they actually distributed it back out to their employees. So some people made some money out of that, but yeah, not a fun thing. But I think what Quit Genius is trying to do is trying to use sort of positive affirmation as well, the BS, to help people, including vaping, reducing vaping, because vaping is basically as bad as smoking, especially as teenagers thought it was cool.
Right.
Hooked on it, and you're still hooked on nicotine, right? Nicotine's the drug. So maybe there's room for another one of these. Somebody somewhere thinks there is.
I guess so. There must be. If not, you can always go with the other drug, the original drug, sugar, because it's Halloween weekend.
I'm looking forward to that. Yes, I'll be up and down the street doing I think we have a local super spreader event for my kids here where there'll be
oh, hey, that sounds like fun. A local super spreader event.
I mean, aren't they all that, right?
I don't know. I'll be here alone wearing this wig.
All I know is I had a THCB gang yesterday in which, we were talking about the rise in events all across the world, including in Germany and France and Wales, and Blackburn in England is like, a little town in England. Its ICU had dozens of people in the ICU, and I think 10 or so deaths over the weekend, and a lot of this that we're not out of the woods in the scariness.
I feel like things are scary, and I think everybody's just so fatigued, and I think that the anxiety has been just kicked into high gear because the election is Tuesday.
There's an election? I hadn't noticed.
Yes, because things only get more frightening from here. So if you would like to hang out with the ghouls and goblins on this show, you can find us over on Twitter. This ghoul is over at Jess DaMassa, and that goblin is over there at Bolty Boy. You can be sure to sign up for email newsletters over at thehealthcareblog.com, which is just like trick-or-treating, only instead of candy, you get stories about healthcare. Who doesn't want that delivered directly into their inbox?
You're not selling that one very well today, Jess.
The
Healthcare blog. Go sign up while stocks last. No more candy after October the 31st.
No way, dude. Candy is an all year round thing. And the other thing I was going to say is if you'd like to, you can just subscribe to our YouTube channel and get these cute little Health and 2.0s. You can alert there on YouTube whenever we post a new one. There was a lot of seed funding in this episode.
Yeah, this is like a wrap up of a lot of seeds, and also give a plug to our friend Brian Dolan at Exits and Outcomes, who somehow found some seed funding that we never heard of. It's like, this company raised 50 grand here and 70 grand there. I'm not sure it really counts, but
this information, 50 grand. Like, this company raised $33,000. Like, whoa, Brian, way to pound the pavement and get those stories.
Must be writing into him. Somebody
finger on the pulse. For the rest of the bullshit, you can count on us. And with that, we'll end it. Happy Halloween, everybody.